Pontic. The ideal requirements of Pontic. It should restore the function of tooth it replaces. It should provide good aesthetics. It should be comfortable to the patient. It should be biocompatible. It should permit effective oral hygiene. It should preserve underlying mucosa and bone. Factors affecting Pontic design: occlusal load, edentulous space, residual ridge resorption. Design consideration for posterior Pontic. All surfaces should be convex, smooth, and properly finished. Contact with the buccal slope of the ridge should be minimal and pressure free. The occlusal table should be in harmony with the occlusion of all the other teeth. The buccal and lingual shunting mechanism should correspond to the adjacent teeth. The overall length of buccal surface should be equal to that of adjacent abutment or pontic. Design consideration for an anterior pontic. All surfaces should be convex, smooth, and properly finished. Contact with the labial slope of the ridge should be minimal and pressure free. A larger contact with the ridge is provided for natural look. If pinpoint contact is given for a case with ridge resorption, unesthetic black spaces may become visible. Lingual contact contour should be in harmony with that of the adjacent teeth. Classification of Pontics. It is classified based on materials used, method of fabrication, mucosal contact, and special Pontics. Based on the mucosal contact, it is classified into ridge lap Pontic, modified ridge lap Pontic, ovate Pontic, modified ovate, root form Pontic, natural tooth Pontic, Lassenberg Pontic, pullet Pontic, hygiene or sanitary Pontic, fish belly Pontic, pearl Pontic. Based on Keith-Thayer's classification, denture-based type Pontic, modified saddle Pontic, ridge saddle Pontic, lap-facing Pontic, egg-shaped Pontic, bar-shaped Pontic. According to Liv and Johnston, sanitary Pontic, anatomic Pontic. So, based on the mucosal contact, the Pontic designs the sanitary or hygienic Pontic. This Pontic have zero tissue contact, hence they are easy to maintain and they are highly anesthetic. The Pontic should be at least 3 mm high occlusogingivally and at the same time provide adequate tissue clearance for easy maintenance. It is usually recommended in posterior mandible. It is saddle or ridge lap Pontic. This Pontic resembles a natural tooth. It is designed to adapt closely to the ridge. It is avoided because it is difficult to maintain and often leads to inflammation of the tissues in contact. Conical Pontic. The Pontic has convex tissue surface which contacts the tissue at one single point without any pressure. This Pontic is very easy to clean and maintain. The only disadvantage of this design is poor aesthetics, which result due to wide embrasures. It is usually indicated for the replacement of the mandibular posterior teeth where aesthetic is not a major consideration. Modified ridge lap. This design with a slight buccolingual concavity where food entrapment can occur. So, in this design, the mesodistal surface should be more convex to avoid food entrapment. The tissue surface of the pontic shows a T-shaped contact where the vertical arm of the T end at the crystal of the ridge, the horizontal arm form the contact along the buccal surface of the ridge. Ovate pontic. These are used in cases where residual ridge is defective or incompletely healed. They can be used in broad and flat ridges. This pontic is designed in such a way that its cervical end extends into the defect of the edentulous ridge. The pontic should be reduced as the healing progresses. The pontic is more aesthetic as it appears to arise from the ridge like a natural teeth. Modified ovate. It is similar to ovate pontic except that the gingival convexity is in more labial relation to the ridge. Based on materials, it is classified as metal ceramic, all metal, fiber reinforced or resin facing. Metal ceramic pontic. The advantages of metal ceramic pontics are aesthetic, biocompatible, and it is a straightforward procedure. The major disadvantage is it's difficult to fabricate if the abutment is not a metal ceramic. And it is indicated in the most situations and it is contraindicated for long span bridges with a high stress. So all metal pontic, the advantage is strength and it single step procedure. The disadvantage is it's permeable to oral fluids and it has a poor aesthetics. It is indicated mostly in mandibular molars, especially under high stress, and it can be indicated in patients with bruxism. The contraindications are where aesthetic is more important. Fiber reinforced all resin. It's conservative when used with inlay procedures, and it shows a better aesthetic and ease of repair. It, the major disadvantage is the long-term success is uncertain, and it is limited to short spans. Indicated at the areas of high aesthetic concern, and the contraindication is long span partial fixed dental prosthesis. Based on method of fabrication, it is classified into custom-made Pontic and prefabricated Pontic. Prefabricated Pontic, true Pontic, interchangeable facing, sanitary Pontic, pin facing Pontic, modified pin facing Pontic, reverse pin facing Pontic, harmony Pontic, porcelain fused to metal Pontic, prefabricated custom modified. Prefabricated Pontic, they are commercially available as porcelain Pontics. They should be adjusted according to the individual requirement. They are finally reglazed and fit to the metal backing. First is true Pontic. This Pontic consists of a large gingival bulk. So it has a horizontal tubular slot running in the center of the lingual surface of the facing. It has two proximal slopes, bevels on either side of the central bulk. This slot and the proximal bevels provide retention. It is indicated in cases with limited inter-arch distance. Interchangeable facing or flat back facing, it consists of a vertical slot in its flat lingual surface. The facing is retained by a backing with a lug, which is designed to engage the retention slot. The tissue contact should be a part of backing to ensure a smooth finish. The major disadvantage of the system is complex design, which leads to accumulation of plaque and the gingival inflammation. Pin facing. The lingual surface of this facing is flat and consists of two pins for retention. It should be positioned over the backing such that the gold porcelain junction does not contact the tissues. It is indicated in the cases with reduced occlusogingival height. Reverse pin facing. Commercially available porcelain denture teeth with pins can be altered to obtain this facing. The pin in the porcelain tooth are ground off and the tooth is altered and customized according to the wish. The precision drill holes are made on the lingual surface of the facing and they act as a source of retention. Harmony Pontic. The facing consists of flat lingual surface with two retentive pins. The gingival surface is usually supplied uncontoured. The porcelain is added to the gingival surface and contoured according to the ridge, finally glazed and finished. These facing are not indicated for the cases with decreased occlusogingival height as the placement of the pins are difficult and proper facial contour cannot be achieved. Special Pontic, Quince Pontic, Laurie Arthur Pontic, preformed Pontic pattern, Pontic clasp, aligner orthodontic Pontic, notch Pontic system, Schwartz Pontic, hidden attachment Pontic, and article. Quin Pontic, introduced in 1958, it's a two-piece Pontic system, the lower or the inner core system made of permanent gingival porcelain with stump, and the upper system is like a tube tooth that can be cemented during insertion. Laurie Arthur Pontic. This is a two-piece Pontic with porcelain top and metal bottom. The metal joint is made as a key and keyway that runs horizontally. Preformed Pontic pattern. It was invented by Edward and Harry in 1969. This is a hybrid of prefabricated and custom made Pontic. The patterns are available in plastic that can be burned out without residue. They provide finish of the prefabricated Pontic and they can be modified for optimal fit and app function. Pontic in aligner appliance. This system was introduced by Trica, Nope, and Burns. This Pontic is also not used in FPD. Instead, they are used in orthodontics. The Pontics are contoured to aid in tooth movement for the appliances used in the Invisalign system. This is made of a special autopolymerizing composite that can bond to the Invisalign appliance. Schwartz Pontic, similar to reverse pin facing, the pins are like large struts for the structural durability. The entire gingival portion of the Pontic is made by facing. The metal packing stops at the upper half of the tooth. Hidden attachment Pontic. These Pontics are customized with an attachment to retain RPD. Most attachment systems are used in this combination. Thank you.